Hey everybody, it's Doug Green and I'm the publisher of Technology Reseller News. We're here at HIMSS 2026 in Las Vegas, and I'm very pleased to have with me today Kassaundra McKnight-Young, CNIO, Zebra Technologies. Kassaundra, thank you very much for joining me today.
Thank you for having me. It's really my pleasure to sit before you today and just talk a little bit.
Well, I'm delighted that we're able to not only talk about a new technology from Zebra and some other things, but also to bring our watchers and listeners a real life clinician. So you can bring into the conversation actual experiences, not abstract, what you've seen, what you've experienced, and what you're trying to do now. So we're going to dive into that in just a second. But Kassaundra, what is Zebra Technologies?
Oh my goodness. For me, a lot of people may know Zebra for print and scan, but Zebra is more than just print and scan. From a healthcare perspective, we went into the mobile space back in, I'm gonna say 2014, and I met Zebra prior to 2014, but as a clinician in 2016, and implemented one of their first mobile devices at the bedside. And at that time, they were a true game changer for the hospital that I worked for, allowing us to reduce our sprawl tech by reducing computers in the room and also reducing the number of devices that we use. So this year in HIMSS, we implemented a new strategy, really trying to advance a new healthcare standard through orchestrated care, where we really automate, digitize, and operize healthcare operations, connecting patients, care teams, and healthcare environments through intelligent operations and workflows and real-time visibility. I told you earlier that we do enable the frontline care to act decisively with precision and clarity at every point of care. And how do we do that? We just don't do that because we have devices to do that. Our devices are designed to really support the clinician to drive safer patient outcomes, to improve workflow, operational, and also to unify that communication. Communication is not just a phone that you can make phone calls, but it's able to receive alerts. For example, the worst time a patient should decompensate at a hospital is during shift change. Um, Studies out there show that what's going on in shift change. We're talking to each other. If you don't have a communication platform in place to support a patient who may go into asystole, and if you, for example, most hospitals have a centralized person watching or centralized station where they're watching patients that are on alerts.
Mm-hmm.
And if I get an asystole, most of the time, 90% of the time, it's probably not true asystole because leads are off, batteries, something needs to be changed. So that person may just get in a habit, like the boy who called wolf, and just cancel out of those. But what about that one time that is real? Okay. If I'm giving bedside report and somebody calls and said, hey, check on the patient in room 205, that's what they said, more likely I'm gonna keep doing what I'm doing. The one time that is true asystole and I walk in the room and a patient has been sitting there for 11 minutes without a heartbeat. Could I have saved that patient? I don't know, but we didn't give that patient a chance or me a chance. So what makes sense to me is really using a platform that has a unified collaboration where I can have those alerts that come directly to my hip. So I can look at that script, let me decide if I need to go in that room and allow me to do work at the top of my license. So that's one way that we really like to enable intelligent workflows.
Now, what you just told me is really interesting because when you're talking about orchestrated care and that's your announcement today. What you're also telling me is that the existing technology sometimes in a hospital is not trusted by the people that are using it. They're not trusting the information that they're getting. You just said basically that they're used to getting false information,
Yeah,
or incorrect information.
yeah, I would route it as alarm fatigue,
Alarm fatigue.
which is really huge. And so in that case that I just explained, it's very common that somebody turned over or a
Right.
lead came off and they're getting false information. And if I've clicked 10 times, because every time it was just the lead came off, about that one time is true. And so they don't trust that that's a true situation, and it is true. Another thing, how we enable not only patients to really be safe, but I talked about our mobility platform and how all the devices that we have, they have programmable buttons. But one of the key programmable buttons we have is a duress, and we have a companion badge now. And so I can be in trouble, or a patient can be in trouble, and I can just say a keyword like "okay, pineapple" and call for duress. As you see
So
right
now
there.
that's the beeping.
Yes, that's the beep. And I just said pineapple. Nobody know I call for help. I can program that to help me, somebody who's close to me to get that, the security get that, 911, and it can go to multiple people. Some hospitals have a panic button that's 15 feet away from me, or it's on a desktop, or one place I know had a whistle that they wanted me to blow, that they are using for nurses to blow. That's not safe care. That's not safe care for me, and it's not safe for even the patient. Evolve Healthcare, they released a white paper out here recently, and one of the statistics shows that clinicians are being attacked 5 more times
Wow.
than any other profession, including police officers. And so, I mean, New York just went on a strike, their nurses did, for safety. And this is one way that we, again, keep our patients safe, but also the clinician.
Yeah. So connect the dots for me. The technology that you released here this week at HIMSS. How does this resolve the issue that you're talking about?
Well, it's what we've been releasing all the time.
All the time. Okay.
This is not anything new. We've been doing this. Like I said, I started using this particular framework, or the Zebra platform, back in 2016. And so basically all of the problems that we had, we try to drive it through our mobility. What Zebra do, this platform is strong enough to actually handle those alerts that I'm talking about, and everything else that really helps optimize flows. It has reduced the text. I have a badge on now, and it says, clinicians are not middleware. When I started working the bedside in 2009, I had to push a cart. I had a desktop phone. I had a pager. I mean, a pager, man.
Right.
I mean, who uses pagers anymore? Actually a camera that was shared among everybody that I needed to do my care with. And then you wanted me to call a physician to tell them this. You wanted me to go chase down a bladder scanner. I didn't go to school to be a middleman.
Mhm.
And so people say there's a nursing tube belt. What I just described was a backpack. I need a backpack to carry all of that work. Plus, I need a ball and chain too, as you're pulling me, trying to get all that done. And how can I give safe care? So with the Zebra platform, and as we focus on our orchestrated care but looking at strategic partnerships that we have that brings things like ambient documentation that not only documents within that chart that capture documentation, but also can connect to things like Service One. And I can walk into a room, instead of now where you walk into a room and see 10 wows on the side because they're all broke. I can just walk in there and say, hey, the wow in room 1101 needs to be fixed. And it can create a ticket just by me talking. So that's just another way of looking at strategic partnerships to really support our platform to do that. I mean, even, we talk about tap to pair with all of our devices.
Yeah, show us the device that you're talking about.
This is our HC50 device that I have right here. But if you are already using our printers in the room, as a clinician, if I walk in, I don't have to search for that printer. All I have to do is tap to pair it. That's huge when it comes to reducing clinician workload. We also have what I would call blood bag parsing. When I'm getting ready to administer blood, normally that's anywhere from a 5 to 7 scan. Zebra has a solution that you can take that 5 scan, create and make it 1, and it can parse into the EHR like it's supposed to just by 1 scan. So just reduce my steps by 4 or 5 to 1 is huge. So this is, again, how we are enabling the frontline care to act decisively, and do what they need to do no matter where they are. And then we look at relationships like with wireless vendors or people like AT&T and T-Mobile, those kind of people that you work with, to keep the connection always. So no matter if you're inside the 4 walls or outside the 4 walls, we have the connectivity to do that. Indoor radios that will jump off any network to make sure you have a most reliable network. And I think that's huge, to always be connected. So no matter what you're doing, if you're administering meds or you're needing an alert, or if you actually just need to make a phone call or receive one, you can do that.
You know, I'm struck by something you said there about the technology that might be in place wasting your valuable time, right? And in other words, the patient, the hospital, everybody there is having the nurse spending time doing things she or he, that's not why they're there, right?
It's
And
not.
so you're saying what you guys were doing here at HIMSS, and also what you've been doing all along, is closing that gap. You're freeing up staff time, clinician staff time, to actually do their job.
Yes. And we do it here at Zebra a little uniquely than any other organization, is because, I'm a clinician.
Right,
And I still work the bedside. I still moonlight every chance I get. And the big part about that is really we're trying to solve a solution. It's not
right.
about the technology. It's really the people, and the people that's actually doing the work first, that matters. And so the hospital I work at, one reason we've been so successful is that we've driven every pain point we had, we've driven it to our mobility, our mobile platform. And that's allowed me to be free. It allows me to walk around with just this in my hand and do everything that I need to do. I can make phone calls. I can receive text messages. I can do smart pump programming. I can do specimen collection at the bedside. I can receive alerts. I can do blood breast administration. I can do blood bag administration, blood transfusion. I can also use another solution. Like when you think about, I don't know how much time it takes to go get an interpreter when you need to ask somebody if they
Right.
want pain medicine or they need something
Right.
to eat. And I don't even know what the cost of that is, but I know what I do see, I see workarounds, because I have to stop and go either find an interpreter, order an interpreter, or find a line to interpret something simple as what's your name, what's your date of birth. That's not anything groundbreaking. It doesn't take NASA to have that. An application on my phone that's approved, a medical application, I can just say, what is your name? No matter if you speak Vietnamese or whatever, and it can speak back to me. So I can do a quick assessment. And at that point, I'm keeping you safe. In reality, you know what happens? Somebody's trying to figure out, Doug, what do you need, with not speaking the same language? And that puts you at risk.
Right.
And that's what, if I could sum up anything, I think that's what Zebra does. We try to help mitigate risk, period, by helping reduce errors that cause harms to patients.
Well, I think on that note, I can't think of a better place where to wrap up. There's so much more to talk about, and I hope we get to have additional discussions. I love the idea that you're actually experiencing using these things and using these technologies on a regular basis. So you're able to bring that insight into our recording today. Where can we learn more about Zebra Technologies?
You can find us on any social media platforms, LinkedIn, but of course at zebra.com.
All right. Well, I'm looking forward to our next podcast, but thank you very much indeed for stopping by today.
Thank you for having me.